Antihypertensive drugs lower blood pressure by decreasing cardiac output. Peripheral vascular resistance, or both. Drug class and mechanism of action. Diuretics. Increase sodium and water excretion, decrease in blood volume, decrease in cardiac output and blood pressure. ACE inhibitors inhibit conversion of angiotensin I to angiotensin II, vasodilation, and aldosterone secretion. ARBs block angiotensin II receptors, vasodilation, and reduced aldosterone effects. Beta blockers block beta-1 receptors in the heart, down arrow heart rate and contractility. Also renin release. Calcium channel blockers block calcium entry into vascular smooth muscle and/or heart, vasodilation, and decreased cardiac workload. Alpha-1 blockers block alpha-1 receptors in blood vessels, vasodilation. Central alpha-2 agonists reduce sympathetic outflow from the CNS, down heart rate and vasoconstriction. Direct vasodilators relax vascular smooth muscle, vasodilation, and decrease peripheral resistance.
Antihypertensive medications are drugs used to lower elevated blood pressure and reduce cardiovascular risk. They work through different mechanisms, including decreasing cardiac output, relaxing blood vessels, and reducing fluid volume. Common classes include ACE inhibitors, angiotensin receptor blockers, appropriate antihypertensive. Therapy helps prevent serious complications, such as stroke, myocardial infarction, heart failure, and chronic kidney disease.
Common side effects of antihypertensive medications depend on their drug class. ACE inhibitors may cause persistent cough, dizziness, angioedema, hyperkalemia, and hypertension. Calcium channel blockers commonly cause peripheral edema, headache, palpitations, flushing, and constipation. ARBs may lead to dizziness, hyperkalemia, and hypertension. Beta blockers can cause bradycardia, fatigue, cold extremities, and erectile dysfunction. Diuretics may result in polyuria, dehydration, hypokalemia, and muscle cramps, while alpha blockers are associated with orthostatic hypertension and syncope.
Now, let's discuss the contraindications and interactions of antihypertensive drugs to ensure safe prescribing. Contraindications are situations where a medication should not be used because it may cause serious harm to the patient. First, ACE inhibitors, such as enalapril, and angiotensin II receptor blockers, ARBs, such as losartan, are contraindicated during pregnancy due to fetal harm. They should also be avoided in patients with bilateral renal artery stenosis or hyperkalemia. Beta blockers, like atenolol, are contraindicated in severe bradycardia, heart block, cardiogenic shock, and severe asthma or COPD, as they can worsen respiratory issues. Calcium channel blockers, specifically verapamil and diltiazem, should not be used in severe hypotension or heart block, as they further slow the heart rate. Lastly, diuretics, such as furosemide, are contraindicated in anuria, severe dehydration, or severe electrolyte imbalances. Understanding these contraindications is vital for preventing complications. Now, let's look at some important drug interactions. NSAIDs, including ibuprofen, can reduce the efficacy of antihypertensives and increase the risk of acute kidney injury, especially in patients with existing kidney disease. Combining ACE inhibitors or ARBs with potassium supplements or potassium-sparing diuretics like spironolactone significantly increases the risk of dangerous hyperkalemia. Using beta blockers together with verapamil or diltiazem can lead to severe bradycardia, heart block, and excessive hypotension. Grapefruit juice can increase the blood concentration of certain calcium channel blockers, leading to excessive blood pressure reduction and dizziness. Finally, alcohol enhances the effects of these drugs, potentially causing dizziness, fainting, or falls, especially when standing quickly. In conclusion, assessing contraindications and reviewing drug interactions is essential for patient safety and treatment effectiveness. Thank you.
I will explain the nursing responsibilities in administering antihypertensive medications, focusing on the Bay rights of medication administration. First is the right patient, where nurses must verify the patient's identity using at least 2 identifiers, such as the patient's full name and identification number, to ensure the medication is given to the correct person.
Second is the right medication. Witnesses must check the medication name, prescription order, expiry date, and patient allergy history before administration to prevent medication errors. The third is the right dose, where nurses must ensure their medication dose is accurate according to the prescription. Fourth is the right route, where nurses must administer the medication through the correct route, such as oral or intravenous, to ensure proper absorption and ensure perfect effect. Next, the right time, where nurses must give the medication at the scheduled time to maintain stable blood pressure control and maximize term effectiveness. 6 is the right documentation, where nurses must record the medication name, dose, route, time, and patient response accurately to maintain continuity and safety of care. Lastly, the right to refuse. Witnesses must respect the patient decision. If they refuse medication, provide appropriate education regarding the benefit and risk. Besides following the 7 rights of medication administration, nurses must also take important precautions to ensure safe drug administration. First, nurses should assess allergic by checking the patient allergic history to prevent allergic reaction. Next, contraindication must be reviewed to ensure the medication is appropriate and safe according to patient health condition. Nurses should also monitor vital signs, especially blood pressure and pulse, before and after administering cardiovascular drugs. In addition, checking for drug interaction is important to prevent harmful effect caused by other medication. Nurses must offset for any adverse effect and take immediate action if abnormality occur. Lastly, patient education should be provided to ensure patients understand the medication purpose, correct usage, and possible side effects.
Route of administration of cardiovascular drugs, oral route.
1. Drug administration. Cardiovascular drugs are taken orally by swallowing tablets or capsules with water. The drug passes through the mouth, esophagus, and stomach, where it dissolves and releases the active ingredients. 2. Absorption. The drug is mainly absorbed in the small intestine due to its large surface area and rich blood supply. It then enters the bloodstream through the hepatic portal vein and travels to the liver. 3. First pass metabolism. The drug reaches the liver before entering systemic circulation. Liver enzymes metabolize part of the drug, which may reduce the amount of active drug available in the bloodstream. 4. Distribution. The remaining active drug enters the systemic circulation and is transported by the heart to target organs such as the heart, blood vessels, and kidneys to produce therapeutic effects. 5. Drug action. The drug produces cardiovascular effects depending on its function, such as lowering blood pressure, controlling heart rate, reducing fluid overload, and preventing blood clot formation. 6. Metabolism. After producing its effect, the drug is mainly metabolized in the liver into inactive metabolites that are easier for the body to remove. 7. Excretion. The kidneys filter and remove the drug metabolites through urine. Some drugs may also be eliminated through feces, via bile secretion, or other routes depending on the drug properties. Summary pathway: mouth, esophagus, stomach, small intestine, liver, blood circulation, target organs, liver metabolism, kidney, urine. Now we're going to explain about intravenous. What is intravenous? It is a method of administering medication directly into a vein using a needle or intravenous catheter. Why IV method be chosen? Intravenous administration is chosen over oral or other routes in high-stakes clinical situations because of 3 main reasons: speed, precise control, and necessity when the gut can't be used. This is how the route of intravenous insertion. First, the medicine enters peripheral vein directly. After that, it will travel through the superior-inferior vena cava into the right heart. Inside the pulmonary circulation, it will pump through the lungs for oxygenation. And what will happen in the systemic distribution is, it will return to the left heart and is pumped out through the aorta to target organs within seconds. Finally, it will go through metabolism and elimination,